This could possibly be the most exciting celebration in my 32 years here at UC Davis Health System. So I've been here 32 years. Some of you might have been here as long as I have, and you also might disagree, and you might think that the most exciting time was back in 1995 when we first got magnet designation. And, but I'm going to say no, I don't think so, and that without any formal designation or any formal honor, today I think is the most exciting and meaningful celebration of professional practice of nursing. So I'm going to tell you why, and we're going to look at the difference between 1995 and today. So raise your hand in the room if any of you have been here since 1995. How many were here then? Okay, so there's a few of you who could argue with me, right? Okay, I think you're going to agree by the end of the day. You have to agree with me. So in 1995, we believed that the staff should be involved in all levels of decision making, but we didn't have a formal process, and we didn't have a formal structure that would enable all of you to participate, and we definitely didn't have the financial support for all of you to participate in this process, as you do now, attending these meetings and in your unit-based practice council. So that was something that was missing back in 1995. So in 2012, we have a structure that's formal. It enables and empowers nurses. Thanks to many of you in this room, Toby and Ellen, for envisioning and pulling together the group to figure out that structure. But today you're going to see examples of how that structure has empowered the staff. And that's what today is all about, is your professional practice. Now, most of you know this isn't really a rapid process. So we've been working on this for a long time, right? All the unit-based practice councils. And to address, to collect data, to decide what you're going to work on, the process, to develop change, to measure it, and then to see once you've implemented something, and then to see if it's really working or not, that takes a long time. You're doing miraculous work in a short period of time, considering that the rest of us trying to do something like that, sometimes it takes us 2 or 3 years to make the change if we're administration. So this is the positive part, is his unit-based practice councils making the change. So each unit we've seen take on topics of interest. Hopefully most of you have taken on small bites, not big bites, but I have a few examples of some major projects that you're working on that amaze me. But you do realize that when you get these small wins, you realize the power that you have. You are empowered, and that you can make the change. And we're going to see examples again all day of that. So I think that formal structure is very positive, and it's a keeper. It's something that is catching on among other disciplines in the hospital. So we know that other departments are seeing the benefits of nursing unit-based practice councils, and they're saying we want one too. And so you're essentially changing the organization. You're setting the example. You're a role model for it. You are leading the way. You're demonstrating that an organization as large as this academic center can change. And it's coming at a time when we have healthcare reform facing us. 2014 is the magic year. And you guys are leading that process. So it will affect every healthcare organization, and some of them aren't as prepared. We will be prepared and ready. So everything that we talk about is always about evidence, right? Evidence-based practice. So again, the evidence that we have about the professional structure, professional governance, will be in the posters that you see today. I've only seen a few. It's amazing, so that's really, really exciting. The other piece that we have, the other evidence we have, is the Moorhead Engagement Survey. And that shows that nurses in this organization are more engaged than other employees in the hospital. And that is a first for the Moorhead Foundation. What they said was that usually other employees in the organization are more engaged than nursing. In this organization, nurses are more engaged than the rest of the institution. You guys drove those scores up for the whole institution because of your engagement. So the other evidence that we have that professional governance works is that we have improved outcomes. So I know that all of you see those dashboards. But I'm going to give you a summary of our progress for 3 years. We have reduced CLABC by 65% over 3 years. You have reduced VAP by 48.7% over the last 3 years. And I know that that's difficult because we're struggling with VAP rates, and we look at them coming in every week. We go, oh no, another VAP. But we have reduced it by 48.7%. And then you've reduced CAUTI by 50.5% over the last 3 years. That's amazing. So good job. So we've taken our professional practice to new heights. And we've done that with our professional practice model. The model was built by you, and it was built in those nursing salons that we held, which was when? Was that just this year, in January? So that's hard to imagine, huh? So you built a professional practice model, and the nice part about that professional practice model is that it incorporated the philosophy and the values that we had developed 21 years ago. So I don't know if you realize that, but we developed a philosophy, and it wasn't developed by administration. It was developed by talking to all the staff at the time and asking them what they valued about professional practice and about nursing. And then we used those values and developed a philosophy. We went back to you and said, critique it, which we got a lot of critique. I'm looking in the room to see if I see anybody who used to comment on it. You commented on it, then we rewrote it, we typed it up. Some of you will remember we tied it up with a ribbon, and we put a personal comment on it for each staff, and we gave it back to you during nurse recognition. So that philosophy is still posted. We made one minor change about nursing theorists. I don't want to get into that one. But we did make a comment about that. But essentially that philosophy drove the group that developed our professional practice model. And those values and philosophy are what got us magnet status 10 years ago, or got it for us so that we could hold on to it for 10 years. So it's a really good model, I think, our professional practice model. You also put, in that model, you put relationship-based care as your structural support, and that builds our foundation around the environment of care and knowledge and quality and safety and resources and respect. And you, when you built that model, it fit together so much, and it results in the outcomes that we see. And that model was built based, the relationship-based care developed from work that the PEDS people did. It's been 15 years with Marie Manthe in primary nursing. And I think that primary nursing has developed so much throughout the whole institution. And again, that's where we're seeing the outcomes. Improve patient satisfaction, and of course you're going to hear from patients later today. Primary nursing is our foundation again, so it reinforces what we do. I would point out another accomplishment of you in this institution, and that is that we use the word patient-centered care. Of course, we've kind of expanded it to patient and family-centered care, but you used that, and you were solely responsible for that word, patient-centered, although it's in our strategic goals, it's person-centered. Patient-centered care got into our goals, and it's the first goal listed for the whole health system strategic plan. And you know why? Because it was nurses who responded to the survey on strategic plan. You were the majority of respondents for that strategic plan. I don't know if you all know that. And your comments were patient-centered care was important, and the institution picked that up. So you get credit for that piece of our strategic plan. You guys took the time and effort to fill out that survey, which is really amazing. And now we're hearing physicians and other people talk about patient-centered care as being important, and that it should drive the decisions we make. So I want to applaud you for that. So we've taken relationships, patient-centered care to new heights, because actually one of the unit-based practice councils, I think ambulatory care, developed a process because they were thinking about the patient and how we communicate. So they developed a standardized process on how information is shared and exchanged when we move patients between the facilities. Ambulatory care, kudos to you for developing that. Science and knowledge is another building block in our plan, in our professional practice plan. And that's used to shape our practice and those of our colleagues. When the magnet consultants were here, was it 2 weeks ago now? Time flies. That staff, they were so impressed that staff everywhere were able to articulate the difference between quality and safety and evidence-based practice. And probably the most remarkable thing was you guys could all articulate the Iowa model for evidence-based practice. That's really impressive. And so, again, kudos to you because that's incorporated into our practice. The other piece is evidence and research. We have, through the Moore Foundation, nurses have applied and received grants totaling $3.5 million or more from the Moore Foundation. These are nurse-led initiatives to improve care, and they're collaborative, so we have physicians on all of those grants, but they're nursing-led grants, which is really remarkable. And probably the most significant one, I know I talked till I'm blue in the face on this one, but the sepsis grant. And it involves every person in this room, and it's a project where you are really saving lives, and you can demonstrate that. And that's really amazing because, again, that's a nurse-led initiative, and it's receiving national attention. It's receiving national attention because it's a sepsis grant, and that everybody's trying to get their arms around how do you identify sepsis. It's also getting national attention because it's the use of EPIC, the EMR, it's meaningful use, and everybody's struggling to try to figure out what that is. And you're demonstrating that, so we're getting a lot of attention because of that nurse-led research grant. So then we have, based on all of this, we have large councils put together. The work of the large councils has been the Research Council. They're driving a lot of this science and knowledge and the Iowa model, and they've developed an online journal club, and I'm seeing journal clubs in other places now, which is really remarkable and amazing. Our Professional Development Council, they're not taking a break, but they're the ones who worked on the salons and staffed it for weeks and hours. And they staffed that, and they're now working on new leadership development and ways to support continuous learning. Our clinical practice councils have worked, and this is probably just an amazing thing. They've worked on handoffs between units, insulin protocol order sets, but the big project they're working on now, which is actually we had a very fortunate to have a presentation at our manager group meeting by Doreen Fowler on the admissions and transfers occurring at change of shift. Is there anyone in the room that doesn't want to see that fixed? Okay. We haven't been able to fix it. I am confident that this group of nurses from all disciplines, all areas, departments, PACU, ER, all the units, the ICUs, that I'm very confident that this group will find a solution. And we're finding data and we're sending it their way. But it's an amazing project, and it's taking off not a small bite, but a big bite. And so, again, congratulations, because that's going to be very interesting to see what happens. Our Quality and Safety Council, they've been working really hard, obviously, because we've got our dashboards now, and all of you, I see them up on your units. You all know them. The consultants, again, said you guys were talking about NHSN and all of these things. That's really exciting because we didn't have that back in 1995. We didn't have dashboards, actually. In fact, across the country, some places still don't have dashboards, so this is really exciting. And then I want to mention the Governance Council. It has oversight from all the councils, and they kind of collect and keep track of what's happening. The exciting thing and also scary thing is that they keep coming up with lots of ideas, and they're chaired under the very capable leadership of Brittany Caldera. And it didn't start out that way. I was supposed to be the chair. She's just running circles around me. She sets the agenda. She follows through. She keeps that project going, that group going. And when we meet, I come out of the meeting every time with goosebumps and work to do because of the ideas that are generated by that group. So that's pretty amazing. And the fact that Doreen came and presented to the managers, I think that blew their socks off. So that's you telling us what's happening and telling us how to do our job better. So before I close, I just want to share one comment with you about, because I know you're going to have a patient and family come and talk today. I just received a letter yesterday from Jean Harlow, and some of you may know who she is. She was the head of the BRN for years. She retired, and she's still volunteering work for the BRN. But she wrote a very nice complimentary letter about her husband's care, and I believe it was on Davis 12. And the letter was quite long, and she just said that nurses did everything right. So this is someone who managed the board, knows what nursing practice is, sets the standards, and she was just super complimentary about the care that she received here from nurses who knew what to do in all aspects. So she covered every aspect, from coordination of care, discharge planning, dietitian support, physical therapy, all the things that she learned about how to care for her husband at home. And so that was a wonderful compliment. So I thank you for that. And I want to thank all of you for making our transition to professional governance so meaningful and inspiring. I really marvel every day at your brilliance. Every time I attend that governance council, I'm telling you, I am amazed. And to hear of your unit-based practice council's work, I don't hear enough of it. I hear little snippets. I really would love to hear everything, but I'm looking forward to the posters so I will see the evidence of your work. We are achieving great outcomes. You are achieving great outcomes, and you are really leading, so thank you.